Assalamu alaikum. My name is Bushra Fees and my roll number is BP1650056 and my group is 54. The topic of my presentation is allergic conjunctivitis. So let's get started. Before knowing the allergic conjunctivitis, we should be knowing what is conjunctivitis actually. Conjunctivitis is basically a disorder of the eye. It is commonly called as pink eye. Conjunctivitis is an inflammation or infection of the transparent membrane, and this transparent membrane is the conjunctiva. Conjunctiva is covering the whitish part of the eyeball and it lines the eyelid. Conjunctiva is richly supplied with the blood vessels, and when these blood vessels become inflamed, so they are more visible and they cause the whitish part of the eye to become reddish or pink. The symptoms which are associated with conjunctivitis are reddish eyes that are accompanied with itching, stinging, stretching, or foreign body sensation. Conjunctivitis is usually bacterial, viral, allergic, or due to chemical splash in the eye or due to any foreign object in the eye. The species which are causing conjunctivitis, mainly bacterial conjunctivitis, are Staphylococcus aureus, Streptococcus pneumococcus, or Haemophilus aegyptius. Now, allergic conjunctivitis. What is allergic conjunctivitis? Have a look. Allergic conjunctivitis is actually the inflammation of the eye which is caused by an allergic reaction to the substances like pollen or mold, spores, etc. It occurs when the eye comes in contact with the allergen, and this allergen will trigger the release of the histamine, and this release of histamine will result in itching, redness, burning, or tearing of the conjunctiva. These are the thin membrane lining of the eyelid and the exposed surface of the eyes. So, allergic conjunctivitis is caused by immediate hypersensitivity type 1 reaction, often due to the airborne allergen. Allergic conjunctivitis may be of two types, seasonal or perennial. The seasonal version of allergic conjunctivitis is due to the exposure of airborne allergen, for example, grass, tree, wheat pollen, etc. And the perennial form of allergic conjunctivitis is triggered by dust mites, animal dander, or moles. Here we have a diagram showing allergic conjunctivitis. We have the difference between the normal conjunctiva and the inflamed conjunctiva, that is showing the allergic conjunctivitis and the redness of the eye. The causes of allergic conjunctivitis: animal dander, pollen from the trees or grass, household dust, chemical scents, for example detergents or perfume. Signs and symptoms which are causing allergic conjunctivitis. How will we get to know that we have allergic conjunctivitis? So, symptoms are redness in both eyes, itching and burning of the both eyes or surrounding tissues, and maybe there is watery discharge which is accompanied by acute discomfort in the bright sunlight. This is also called photophobia. Now, the complications associated with the allergic conjunctivitis: in the cases which are severe, allergic conjunctivitis may lead to scarring of the eye. There may be scars in the eye, and in case of infective conjunctivitis, the infection can spread to other areas of the body and will trigger more serious secondary infections, which includes meningitis. Now here is the main topic. We have a case study and we will look what it says. So, a 36-year-old white male presented to the emergency department with a chief complaint of ocular itching and redness that has persisted for 2 days. He also experienced tearing, photophobia, and burning in both eyes. The patient denied experiencing any trauma but did report of having a cold that began 3 to 4 days before the presentation of ocular symptoms. He denied using any medication and reported no known allergies. His best visual acuity was 20 by 30 OU at distance near through 1 diopter. Spectacles. He rubs his eyes when they itch. Pupils were equally round and reactive with no efferent pupillary defect. Extraocular muscle movements were fully unrestricted in both eyes. Refraction uncovered a slight increase in myopia minus 1.25 diopter, which yielded little change in the acuity. His intraocular pressure was measured as 18 mm of Hg. His ocular history was remarkable for an esotropia which was surgically corrected. It is a disorder of the eye basically. How would you approach this case? Does the patient require any additional tests, or what is your diagnosis, and how would you manage the patient, and what's the likely prognosis? Now we have the SOAP note. What is basically a SOAP note? SOAP notes comprise of 4 different things, that is SOAP. S stands for the subject, O stands for object, A stands for assessment, and P stands for plan. So now we will look step by step. The chief complaint of the patient, that is ocular itching and redness. Now the subject. In the subject we will see the age, the gender, the onset of the infection which was 2 days before, and the location of the infection, then the duration of infection which was 2 days before, and the characterization, then how we characterize that this infection is allergic conjunctivitis. There may be itching, redness, tears, burning, and photophobia in the eyes. Temporal patterns which are making it worse. Rubs his eyes when they itch. Intraocular pressure was 18 mm Hg. Corrected visual acuity was 20 by 30 OU. History. The patient had esotropia but no previous history of known allergies. Means he had esotropia which was corrected surgically, but he had no history of allergies. Now the object. The patient had not experienced any trauma, but he was having a cold that began 3 to 4 days before the presentation of ocular symptoms. He had a history of esotropia which was surgically corrected. His corrected visual acuity was 20 by 30 OU. He was also experiencing tears, burning and the photophobia. Now assessment. What is our assessment in this case? Tearing, itching and redness, burning indicates that this case is bilateral allergic conjunctivitis. Now the plan. What is the plan of the treatment? The main symptoms of itching and redness are relieved by the use of topical vasoconstrictor, and these topical vasoconstrictor may include antazolene, nefazolene, and tetrahydrozoline, and they can be with or without antihistamines. So this example includes antazolene, which can be used to treat hyperemia but shouldn't be used excessively because it can cause congestion. He can also be recommended to use ophthalmic antihistamine H1 receptor antagonists, which are effective in the treatment of allergic conjunctivitis. And these H1 receptor blockers antihistamine basically includes levocabastine 0.05% BID to QID 2 times to 4 times, and 2 hourly to 4 hourly, or olopatadine 0.1% BID, ketotifen 0.025% BID to QID. He can also be prescribed to take topical combination medication, means combined therapy, such as petanol and petade, olopatadine 0.2%, Alcon, Zeditor, ketotifen fumarate, Novartis. Combine the effect of mast cell stabilization with antihistaminic properties, and this will remove the symptoms immediately and increase the resistance to the additional further episodes of the conjunctivitis. Topical corticosteroids may provide relief. He should be instructed to avoid the use of such substances that participates in the symptoms, for example, pet dander, dusty environment, soaps, colognines, etc. And in severe cases, the patient may be treated 4 weeks with a loading dose of either we can use mast cell stabilizers or topical combination therapies to retard the process. Now, the note. the ideal treatment would be the removal of allergen. That allergen should be removed from the eye, which is causing the allergic conjunctivitis, but it is difficult. So allergy should be diagnosed with the allergen test or the blood test in the conjunctiva. It should be done by taking the scraping of the conjunctival tissue to examine. By this we will examine the allergen. To ease the symptoms, avoid rubbing your eyes. Applying a cool compress into your eye can reduce the inflammation and itching. Avoid exposure to harsh chemicals, dyes, perfumes, etc. Over-the-counter medications and drops are used to reduce the congested blood vessels. And the diet which is effective in this case is green leafy vegetables like spinach, cabbage, fruits, vegetables like orange, carrots, papaya, mangoes, etc. All fruits like apple, orange, peas, pineapples, grapefruits, grapes. One fruit that needs to be avoided in this allergic conjunctivitis is banana, because it can cause adverse reactions or adverse effects. So this is all about the allergic conjunctivitis and the case study related to it. Thank you so much.